طبعا يعني first of all I have to say that I'm proud of my young colleagues. دكتور علاء today يعني talking about anterior shoulder instability, and yesterday عندنا محمد سمير ومحمد سليمان وباهر وأحمد عباس. Actually they are my tomorrow, and دكتور محمد خالد طبعا. فيعني I think I have pride tomorrow إن شاء الله. بما ان الدكتور حمدي كان مش حاطط لي محاضرات، فانا كنت دايما بستغل السيمبوزيا عشان برضو احط انا حالات، وابقى يعني حضرت المؤتمر يعني كحضور. This is a female 48 years old and she complained of course of knee pain and stiffness. في عجالة. حد يقول لي ممكن اعمل للعيانة دي ايه؟ استعين برأي حضراتكم. Suggestions. 48 سنة female, she's not obese. Pain, stiffness, complaint of osteoarthritis. Range of motion almost, the left side is almost for range of motion. There is a limitation of the right side.
الحقيقة في الأوستيوارثرايتس حسب الجايد لاينز بتاعت الجمعية لا يعتمد على الأشعة في تشخيص الأوستيوارثرايتس. يعني هم 4 جريدز، ممكن تلاقي نمرة 4 ده بيلعب وبيجري ومفيش أي حاجة، وممكن 1 هو اللي شايلينه إيه. فطبعا زي ما بنقول إيه السيمتومز بتاعته وإيه الساينز في الكلينيكال اكزامينيشن دي أهم من الأشعة.
Actually, there is poor correlation between the radiological presentation and the clinical presentation of the patient. حضرتك قلت high tibial osteotomy. العسال بليت. Bilateral. bilateral left right.
هي الرايت اللاترال كومبارتمنت فيها للاسف ديجنريتد يعني. هي طبعا هتبقى
lateral of both sides.
اللاترال هتبقى في الليفت فيري افكتيف جدا ان شاء الله يعني. الرايت عشان الاوستيوارثرايتس باتيلو فيمورال ادفانسد واللاترال كومبارتمنت فit may not give the patient the best results.
Yes. Actually, I totally agree with this opinion, and that's what I did. Actually, I did high tibial osteotomy of the left side using a Al-Assal blade, and I know that this session will be the chairperson will be my professor, Dr. Al-Assal. That's why I showed this X-ray. 6 months later.
أنا لو منك كنت هديلهم الريكوكس برايت.
نسبوه خلاص يا باشا. طيب.
وجوينتا.
This is a post-operative X-ray, follow-up X-ray. The patient is fine. Actually, the realignment procedure, the main aim of the realignment procedure is not full relief of pain. Actually, the main aim of this is to buy some time for the patient to avoid the rapid progress of the osteoarthritis, avoiding total knee replacement, and that is the concept. This is a post-operative X-ray with standing view, and you can appreciate that the right side is 3-compartmental, as Dr. Hisham said. And the next step I will show after some time. Actually, احنا جبنا من الآخر. We began from the end. This is the surgical options of the treatment for the patient with osteoarthritis. And the surgical options are either high tibial osteotomy, realigned procedures, or total knee replacement, or even arthroscopic debridement. It may have a role. But let's start with what is osteoarthritis. Osteo is the Latin for bone, arth for joint, and itis for inflammation. It looks like it's an inflammation of bone and joint, which is actually not fully true, because osteoarthritis is a wear and tear process. It's a degenerative process rather than an inflammatory process. This is articular cartilage, white, glistening, smooth, and resilient, and beautiful. وكل جمال في الدنيا مدفوع الثمن. الثمن الذي دفعه الارتيكولار cartilage to be with this beauty, it is avascular, aneural, and lymphatic. Being avascular means it is not capable of regeneration. Once degenerated or injured, it is incapable of regeneration. يعني ما فيش رجوع للخلف. I will not ask you about that, but this is kind of sweet. It's called eyeball sweet. حلوى المقل. ويقولون أن الناس قديما كانوا يأكلون عيون أعدائهم ليصبحوا أقوى. I really cannot eat this. However, I can eat this soup. It's an eyeball soup. You can see eyeball and 2 types of spaghetti. The soup is 80% water. And actually, this is for me represent the composition of the articular cartilage, which is those eyeballs which are the chondrocyte embedded in a matrix of proteoglycans and collagens. And of course, 80% of the soup is water. 80% of the cartilage is also water. Actually, يقوم هذا الكون على البالانس. This is eyeball. I made it myself. And the eyeball, or the chondrocyte, it produced the degradative enzyme and the synthetic enzyme. And there is kind of balance between the breakdown and the production. Unless إن يبقى في حد يجي يزعل الكوندروسايت, which is a risk factor. If this happens, the degradative enzyme will be excreted more and the breakdown will be more ويختل الكون. بتحاول الكوندروسايتس ان هي تتغلب على هذا وتعمل more production of the matrix. After some times, the collagen type will be switched into collagen type 1, which is mechanically different from collagen type 2, the usual collagen. After some times of stress, this chondrocytes بتتقل عليها الهموم والمصاريف, and she decide to suicide. تقرر انها تخلص من حياتها وتموت. That is what's called apoptosis or programmed cell death, and this will means more destruction of the cartilage. The flakes and the products of this breakdown will be released in the synovium. That's why there will be synovites. مين اللي يقدر يزعل الكوندروسايت؟ risk factors. Two types of risk factors, avoidable or non-avoidable. Avoidable, it's destiny. We can't avoid. Age is a destiny. We can't avoid. By age, we will all have osteoarthritis. Family history. يعني لو حد عايز يتجوز لازم يسأل الحاجة أخبارها إيه. Being a female is also unavoidable. Osteoarthritis is common in females. Avoidable causes overweight, overuse, muscle weakness, and actually this is one of my relatives. He got injury bilateral, and this major injuries ended in osteoarthritis. Avoid the avoidable. And this is a radiological correlation. There is a weak relationship زي ما سيدنا الدكتور علاء قال ما بين الsymptoms or clinical presentation of the patient and the radiological presentation. This patient is 29 years old. However, she's obese. That's why she got osteoarthritis early. And this patient is 70 years old. However, he is not. And now we comes to treatment. Actually, when I was young, and I'm still young, there was a famous movie. It's called Cleopatra. And this actress is called Elizabeth Taylor. And يعني مضى وقت طويل لتتحول كليوباترا الجميلة إلى ليز العجوز. This is the effect of time. And actually, osteoarthritis cannot be cured. في بيت شعر ظريف كده بيقول لك عجوز ترجى أن تكون فتية وقد نحل الجنبان وحدودب الظهر تدس إلى العطار سلعة بيتها وهل يفصح العطار ما أفسد الدهر. أهو الأوستيوارثرايتس هذا هو ما أفسد الدهر. And we don't have cure for it. However, إحنا كعطارين we have something to offer. We have 3 approaches. The surgical approach in which I began, and 2 other approaches. The non-pharmacological approach was have to be tried in every patient. It's a chronic disease. مش هندي العيان أدوية طول عمره. وأخيراً in pharmacological approach اللي إحنا بنتكلم فيه. طبعاً non-pharmacological approach, lifestyle modification, weight loss. In literature, loss of 5 kilograms will lead to 40% reduction of pain of those patients. طبعا الأناقة ملهاش لازمة. الهاي هيل والموفمنت مهمة لأن الارتيكولار كارتريج اكشلي بيغذى بالديفيوجن عامل زي السفنجة تدوس عليها تطلع المية اللي فيها تقلل تعمل دي كومبريشن ترجع المية تاني كومبريشن ووتر ان دي كومبريشن ووتر اوت ووتر ان ووتر اوت. That is how the articular cartilage is nourished, and that's why we advise those patients to move to improve. This is also you have to avoid lifestyle modification, walking aids. We come to the pharmacological approach. We have either the analgesics, the non-steroidal anti-inflammatory, and the counterprotective. In fact, I will come to that later. If there is any base for the use of glucosamine chondroitin prescription, the guidelines of the American Academy changed from 2017 into it doesn't support into oral supplements may be helpful in osteoarthritis. And this is the treatment algorithm of SQ, which is the European Society for Clinical and Economic Aspect of Osteoporosis and Osteoarthritis and Musculoskeletal Disease. And this algorithm has 3 steps. Step 1, in which we use counterprotective as a first-line treatment in addition to paracetamol. Paracetamol is safe for all patients. Up to 4 grams a day may be safe for those patients. And if the patient didn't improve, we will come to topical non-steroidal anti-inflammatory drugs. The second step, if the patient doesn't work with the first step, is the non-steroidal anti-inflammatory, either the non-selective non-steroidal anti-inflammatory or the selective. Whatever the non-steroidal anti-inflammatory used, the bottom line is the least possible dose for the shortest possible time. Later on, if this patient is still symptomatic, we can go either to intra-articular hyaluronic acid or even corticosteroids have a role in the intra-articular injection according to this algorithm. Short term.
هنزود معاها معلش في اللوكال انجكشن الريكومنديشن بتاعت الاوستيوارثرايتس في الجمعيه اتخذت ان نو لوكال انجكشن اوف بلازما تستخدم بس في السوفت تيشو او في اصابات الملاعب، تمزق، حاجات زي التنس البو، بلانتر فاشيتس، لكن ما فيش حقن داخل المفصل.
طيب يعني my juniors are all healed and they have to hear that. Actually, we have learned that we experienced about like 3 cases of intra-articular injection of plasma presented with severe infection, and one of them ended in arthrodesis and it was about to amputate it. That's why we've actually warned against PRP injection inside the knee. Short-term opioids, tramadol, I'm not sure we can do that. But however, we can use duloxetine. احنا بنتكلم على الكوندرويتين سلفيت مع الجلوكوزامين، لكن البريسكريبشن جريد مش اللي موجود في اي حته، اللي هو الفارماسيوتيكال جريد كوندرويتين سلفيت. This is kind of evidence من الليتريتشر. نشر في الايولار ان الكوندرويتين سلفيت 800 مللي جرام ادي في 604 عيان. مش انت والدكتور حمدي تمام؟ 800 مللي جرام من الكوندرويتين سلفيت.
مظلوم يا بيه، مظلوم والله.
بعد improvement of function superior to placebo and similar to silicoxib. ودي حاجه ثانيه في على اللونج تيرم افكت على حوالي 1600 عيان. والكونكلوجن برضو long term protective structure modifying effects of glucosamine chondroitin sulfate in treatment of osteoarthritis. And this is also the last one of collagen supplementation on osteoarthritis meta-analysis. The results of this meta-analysis showed that collagen is effective in improving osteoarthritis symptoms by decreased both the VAS and WOMAC scores. And this is back to the case. This is the case taking to the operative room. You can appreciate the scar of the previous operation. It was the high tibial osteotomy. And now we are going to do the total knee replacement for the other side. And you can see the intraoperative view of this patient with destruction of the cartilage. And this is a post-operative X-ray of both sides of the patient. And that's ended in TKA. Actually, thanks to Elixir Pharma for sponsoring our conference, and thank you so much.
Thank you.